The Valley's original morning magazine show, ABC 15's Sonoran Living Live.
Cancer treatment can be extremely painful for the person living with it, and watching someone you love deal with it can be just as difficult, if not more. So this morning we may have some help for you. Dr. Jennifer Linder is here with advice to help cancer patients adjust. Good morning to you.
Good morning.
The thing that I like about this segment is that we're really trying to make people feel better about this process, because it's all about that mind-body connection. And you're going to help us with this.
Exactly. So the reality is, if you feel good about yourself during this difficult time frame, you're going to look better, feel better, and you're going to come out better because you're feeling happier.
And with chemotherapy, really, well, everything that we do to our bodies comes out on our skin, and especially so with a treatment like that.
Well, the reality is your skin is your largest body of elimination, or largest organ of elimination, which means that basically all those toxins that are necessary to kill cancer are also coming out through the surface. So you're going to end up, unfortunately, with some side effects.
Well, we know that you're very progressive in what you do there at your practice. So we're going to do some skincare 101. And with cancer patients, there are a few things that we need to be doing differently to look better.
Right. Unfortunately, while you're going through chemotherapy, you probably need to change your regime because you need to make up for some of these potential side effects. Most important is hydration. So during chemotherapy, your skin tends to get very, very dry, and so you want to hydrate with things that have things like glycerin or urea. And my favorite product is this one called Hydrating Serum. It does exactly what it says it does, and it's incredibly moisturizing and just really hydrates the skin and gets it into a healthier place so that you look better and feel better.
How often should we be hydrating our skin?
The reality is, when you're undergoing a process like this, a couple times a day is a minimum, and living in Arizona, we probably need to do it just as frequently.
Really?
Yeah, just because it is so dry here.
So once when we wake up in the morning after we wash our faces?
And then before you go to bed.
Okay, seems simple enough, right?
Exactly. So the other side effects that commonly happen besides dehydration are sensitivities, hyperpigmentation, and I actually have a picture of that so people have an idea what we're talking about, tiny little brown spots in general.
And this doesn't just happen to cancer patients, it happens to everybody.
Right, it can happen to anybody.
Or it can happen to everybody.
Exactly, from the sun exposure, any sort of irritation, but it happens very frequently during chemo. And so you want to choose products that take care of that. I really like a sunscreen that has some tyrosinase inhibitors in it, which basically are things that help eliminate brown spots. And then you also want to make up for things like folliculitis, which looks a little bit like acne, but it's an irritation of the hair follicle. So you want to choose things that are anti-inflammatories.
Okay, we know that you have products there, and we'll get to yours in a moment, but are there any over-the-counter products?
There's always great over-the-counter products. It's about choosing things that are really creamy cleansers, things that aren't irritating. You want to avoid things like salicylic acid. You really want to get the skin looking great. So this picture is actually an example of a patient who had started treating her skin prior to chemotherapy, and then what she looked like afterwards. So often you look much worse after chemo, but if you start treating your skin beforehand, you can actually look better.
She's got more color in her skin here on this after shot. That's great.
Yeah, it's really a nice outcome to see, is that because if you look good during the process, even as a stranger saying, hey, your skin looks great, will make you feel better about yourself. And it makes it easier to get through that whole process.
It does, and you can just go on natural as well.
Exactly.
So show me some of these other items that we can be using, or at least that we can be recommending.
Right, so you want to choose something that's really a moisturizing cleanser. So I like the PCA creamy cleanser, but something that really is going to hydrate your skin during the process of washing. And then you want to use things that help to, of course, protect you from sun exposure. So a minimum of an SPF of 15, and then I like this one because it does help eliminate pigmentation as well.
All right, Dr. Linder, thank you very much for your time this morning.
My pleasure.
Appreciate it. We want to thank you for your time as well. And by the way, if you want to get a hold of Dr. Linder, just go to our website. That's abc15.com and click on the Living tab. Hopefully you'll get out there and have a great day. Boy, it feels like the overall message today has been all about moisturizing and staying well hydrated. 100 the forecast high.